Om Dham Dhanvantare Namaha. Karpura Gauram Karunavataram Samsarasaram Bhujagendraharam Sada Vasantam Hridayaravinде Bhavam Bhavani Saitam Namami. Let me share. The third topic is Ayurveda management of hypertension. Hypertension means high blood pressure. When the systemic blood pressure is raised above 140 by 90 mm of Hg, it is considered as hypertension or high blood pressure. Ayurveda has its own role in the management of hypertension. We have medicines, sedatives like Mutra drugs and sedatives, CNS depressants, that means Ayurvedic CNS depressants, and emetinics, anxiolytics, and hypnotics. These drugs are used in the management of hypertension. Hypertension is a cardiovascular disease. It is caused due to multiple causative factors. And blood pressure exceeds 140 by 90 mm of Hg, it is considered as systemic hypertension. Hypertension can be classified according to the severity as mild, moderate, and severe. Ayurveda and integrative medicine have a positive role in the management of hypertension. Use of disease-specific medicines, treatment of causative factors, relaxation therapy, practice of yogasanas and pranayama, satyapatya prayoga, diet therapy, and panchakarma are advised in the management of hypertension. Use of modern drugs are also necessary in the management of severe hypertension. Ayurveda diuretics, hypercholesteremic, vasodilators, erythrolytic drugs, emetinics, Mutravirechinian drugs are used in this disease. Present paper highlights about the Ayurveda and integrative management of hypertension. Hypertension is usually caused due to hyperactivity of sympathetic nervous system or other organs pathology like kidney disease, liver disease, and cardiac disease. It is mainly classified as primary and secondary hypertension. Ayurvedic medicines are more effective in mild and moderate types of hypertension. These drugs mainly used in the management of hypertension includes diuretics, CNS depressants, drug acting on blood vessels, and antistress and adaptogenic drugs. So this is the cardiovascular system. It's the heart and blood vessels. Heart, the arteries, arterioles, venules, and veins and venules. This is the heart. So it has four chambers, two atria and two ventricles, and major blood vessels. So cardiovascular system. This is the cardiovascular system of heart and blood vessels. So Sarpagandha, Videnia somnifera, these roots are used in the management of hypertension. It's the best hypotensive drug. It acts centrally, it acts on the brain, the dopaminergic neuron receptors, direct depletion of the presynaptic cleft. When the presynaptic cleft dopamines are depleted by the action of Sarpagandha. Thereby, sympathetic activity on the reticular system is reticular activity system is reduced, and there will be reduced peripheral resistance and blood pressure is reduced. So this is Satavari, which has a stomach action and CNS depression, and it has also hypertension. And this Jatamamsi, CNS depressant, it is sedative and hypnotic, and it acts centrally to decrease the blood pressure. This is Tagara, which is hypnotic and sedative. It's also centrally acting hypertensive drug. So hemiplegia is a complication of hypertension. Hypertension is severe, more than 200 by 120 mm of Hg. In old age, usually after the age of 50 years, there can be hemorrhage, aneurysm, and cerebral hemorrhage occurs. That was hemiplegia. It's a complication of hypertension. And nephropathy, hypertensive nephropathy, causing bilateral pedal edema, nephrotic syndrome. Hypertension, not sorry, nephropathy, where the glomeruli there will be sclerotic changes, and retinopathy when the retina, the blood vessels, there will be bleeding, tiny hemorrhages due to hypertension. Let us see drug acting of hypertension. Mutral drugs, mutral action, diuretic, vasodilator, sedative, CNS depressant, anxiolytic, hypnotic, rasayanam, drug acting on blood vessels, sympatholytic, cholinergic, centrally acting drugs, emetinic, medhya, rasayana, antistress, adaptogenic, buddhivardhaka, and mutra action. So let us see one by one. Mutrala drugs, Pitavarpati, Punanavadi Mandora, Punanavasva, Punanavasta Kashaya, Oksharabiya Churna, Varnadi Kashaya, and Tanapancha Kashaya. Diuretics are the similar. Vasodilators, Manjishta, Asana. Sedatives, Brahmi, Sarpaganda, Dagara, Arasikevani, and Mandukapani. CNS depressants, Jatamasi Churna, Manasamitrataka, Arasatarishta, Amivati, Medyavati, and Sarpagandavati. Anxiety drugs, Amchadipata, Agara tablets, Avadabist, Ashwagandha. Hypnotics, Sarpagandavati, Shirodhara, Sarvangabhyanga, Nasya, Voshataki Nasya, and Dams. Drug action blood vessels, Manjishta, Rubia cordifolia, Ushira, Viteria, Regionoides, Sana, Raktayandana, and sympatholytics, Pitavari, and sympatholytics, it's Kumuda and cholinergics, we have Brahmi, Mandagavarani, and Varuna, Ushmanda, Sarasa, Tapusha, Dervarbi. We have central acting drugs, Sarpagandavati, Agara tablets, Nasamitrataka, Medyav. Hematinics, Pranadi Mandura, Noyasalaha, Rakshadideha, Dohasam, Datil. Major drugs, Midrasana, Ramivati, Medyavati, Udisarasa, Sangoshishira, Sarsa. Antistress drugs, Katavari Sarasa, Shirodhara, Sarvangabhyam, walking meditation, Pranayama, and Yogasana. Adaptogenic drugs, Ashwagandharishta, Uruchikashaya, Amalakirasana, and Medyavati. Buddhivardhaka drugs, Kushmandavadeha, Sarasarishta, Mandukavarni Sarasa, Karnamali Vasanta, and Swarnavasana. Mutra Viricina drugs, Oksharabiya Churna, Varnadi Kashaya, Vanamithamala Kashaya, and Vashana Vedadi. Patyas, let us see the Patyas. Palli Phalas, Trapusa, Airvarka, and Vartak, Saindavalavana, Yavamanda, and Narikela Jala, plenty of water, Ushmanda, Kamalanala, moderate exercise, and daily walking. They are Patyas. And Patyas, Lavanavarti, fatty food items like fixed oils, ghee, garam masala, spicy foods, sedentary life habits. Coming to discussion. Hypertension is caused due to hyperactivity of sympathetic nervous system or other organ pathologies like kidney, liver, etc. If systemic hypertension is not poorly treated, not properly treated, then complications like neuropathy, retinopathy, CKD, nephropathy, left ventricular failure, pulmonary edema, and cardiovascular respiratory failure, cardiorespiratory failure are seen. So hypertension should be properly treated. Extreme caution. Ayurveda medicine advocates use of mutral drugs, additive drugs, and treatment of causative factors and or primary diseases, treatment of complications of hypertension, use of patya, diet therapy, walking meditation, moderate exercise, suitable panchakarma therapy, and practice of yoga, pranayama. Drugs used in the management of hypertension, having the actions mutrala, CNS depressant, sedative, anxiolytic, hypnotic, medhya, anti-stress, adaptogenic, and rasayana actions. By Ayurveda medicine, mild and moderate types of hypertension can be treated, controlled, and prevent the development of complications. Coming to conclusion, by Ayurveda treatment, we can control mild to moderate hypertension. We can prevent the occurrence of complications of hypertension by Ayurveda medicine. There are least adverse drug reactions after Ayurveda treatment, even on the prolonged use. Sometimes we can get permanent relief by changing lifestyle, food habits, and daily regimen along with the treatment. These are the answers. So thank you for patient hearing.